The Alter G is a treadmill. It's an anti-gravity treadmill. The treadmill is a standard basic treadmill. It functions like a normal treadmill, but it has a large airbag around it that allows patients to be enclosed inside the airbag and allows them to be unweighted to a certain percentage of their own body weight so that they can utilize walking on a treadmill, getting back after injuries to a much quicker or faster rate than what we normally would on a normal piece of equipment. We see a lot of patients that have had hip surgeries or hip injuries, knee surgeries or injuries, and ankle injuries. The reason why they're using the Alter G is because they may have had an injury or a surgery that they need to get back to walking, but they may not be allowed to walk using their full body weight yet, so we can put them in the Alter G. We can unweight them to whatever percentage either the physician that did the surgery wants them to be, or at whatever level we feel is appropriate at that time. And then they can begin their walking and exercise program in an unweighted environment at a much quicker rate. The way it works is the patients put on a pair of special shorts. The shorts have the zipper around the top of the shorts. The Alter G, the bubble basically collapses down. They can step into the machine. We pull the framework around them at their waist level, and their shorts zip into the top of the bubble. So their lower extremities from the waist down are enclosed in the air bubble, and then we turn the machine on, and it allows us to then unweight them from that point. Yeah, so we do require that patients have a fairly well-healed incision, just for safety reasons because multiple patients are using the same equipment. But like in a pool setting to where we're worried more about infection of the patient, getting an infection with the water, we don't have to worry about that as much with the Alter G. So we can usually start them a little bit sooner than what they might be able to start in an aquatic environment. Usually a few weeks, 2, 3, 4 weeks after surgery, we can start them in the Alter G, but they might have to wait a few more weeks to be able to get into an aquatic environment. A lot of patients don't always feel comfortable in water. So the Alter G, it's a land-based therapy. They don't have the water around them. It does require a little bit of balance coordination. So we also see some patients that have neurologic issues that can use the Alter G. One of the restrictions is they have to be able to balance from the waist up. And there are hand grips on the Alter G that allow them to be able to control their upper body. But yeah, they don't have to be submerged in water, and that helps for a variety of reasons with a lot of patients. The Alter G is one of the only pieces of equipment like that in this whole region. A lot of universities, professional sports teams use them, but obviously the general public does not have access to that stuff. So from a local perspective, we're one of the only facilities in this whole region that has one.